We're joined by two experts now in the field. Firstly, Professor Virginia Lewis, welcome, who is the Research Chair in Community Health at Latrobe University. And Dr. Nicholas Hunter, next to her, is a Research Fellow at the Centre for Health Systems and Development, also at Latrobe University. Thank you so much for partnering with us on this work. And Professor Virginia Lewis and Dr. Nicholas Hunter are today in conversation with VCOSS's Director of Communications, Ryan Shields. So I'm going to pass over to Ryan now. Thank you.
Thank you. Thank you, Juanita. Yes, we're playing a bit of hot seat today, which always adds a bit of spice to these affairs. Thank you both for joining us. We heard Juanita mention the mountains, the room full of evidence and literature sitting behind this as a concept and as an area worthy of our attention and analysis. We want to unpack that a little bit today. So I might start with you if I can, Nick. Can you just talk us through and point us to what is the evidence and the volume of sort of literature that we're talking about?
Yeah, well, the evidence is quite vast. It goes back to the 1990s in the UK. There's other terms that are used, of course, with energy hardship, energy poverty, fuel poverty, energy insecurity. All these things mean the same thing, and these have been used across 30 years. In multiple countries, there's been a lot of work done. So in terms of the health impacts that are related to energy hardship, there's no shortage in terms of the number of different negative health outcomes. So in the physical health space, you have things like cardiovascular diseases, respiratory diseases, communicable diseases, so cold and influenza. In the mental health space, stress, depression, anxiety are all linked to energy hardship. And the general well-being domain, so decreased life satisfaction, health-related quality of life is quite low, and that's associated with energy hardship as well. So suffice it to say, there is a lot of evidence across that 30 years that links energy hardship to those various domains.
Yeah, and a lot of the research and the literature that you're referring to is now available on the VCOSS website, so vcoss.org.au/energy health. You'll find the link there to the resource, the provocation document that's been spoken about today, but also to the resources and sources for some of what we're talking about. Just one quick little follow-up on that one, if I can be a little bit cheeky. So I did read in the documents that in the Northern Hemisphere, a lot of the literature is there, but it's, of course, dealing with cold homes. And we here on the other side of the world, it's more a heat focus. Is that the way?
Yeah, well, yes and no. So in Victoria, we're obviously in a temperate climate, so we can have both extremes. So we're certainly dealing with extreme cold and extreme warmth. So, of course, there are different responses to that. There are different consequences, and therefore there are different interventions that are needed to respond to those. So we are in quite a unique situation in Victoria, which means that we do need to at least acknowledge that and build an operational framework around.
Yep. And when we do look to those other countries, what can we point to of interventions that have been done effectively, how people are addressing?
Yeah, sure. So that was a big part of what we were doing. So specifically with our literature review, we wanted to look at how energy hardship has been tackled in other countries. And we found that when we pulled all of the literature together, there were 5 domains of different types of interventions. So at the highest level, you have your policy and your regulatory framework. So we're talking about the stuff that's happening at the government level that is responding to, I guess, creating more equitable pricing and so forth. So, for example, your market regulation, your energy performance schemes for NAFAs, and various other forms of policy that try to target more equitable outcomes. So you have your policy and your regulatory frameworks. There is, of course, financial support. So we're talking about your fee waivers, your grants, your subsidies, your concessions, your progressive pricing schemes. So, of course, these are targeting the individual and giving them payment solutions for temporary difficulties that they're facing. Another domain is housing changes. So, of course, in many instances, energy inefficient homes do, of course, leak a lot of the energy, and that, of course, is comes up in the in energy bill payments. So it creates payment difficulties. So changing the infrastructure itself, so making more energy efficient homes, so installing boilers, putting in new insulation. These are also different types of interventions that happen across the world. A fourth domain is consumer behaviour support. So, for example, in Victoria, we have Victoria Energy Compare. So these types of interventions are focused on changing people's behaviours, improving their knowledge, giving them the literacy to navigate the energy market. And as a fifth domain, advocacy and coalitions. We heard about that before. These are a key type of intervention as well. So across the world, these are the common types or domains of interventions we have.
Yeah, wonderful. Thank you. And Jenny, I'm going to get to you in a minute, but one more just for you, Nick. You mentioned some of the Victorian initiatives in passing there, but can you just talk us through what is Victoria doing, if we just narrow our focus just to Victoria to address this?
So I guess in Victoria, there is obviously a lot within the financial support space. So of course we have things like the utility relief grant scheme and other types of concessions. Those are quite common, and those are available, usually every fiscal year. There's a small number of energy efficient housing interventions that are done. For example, Sustainable Victoria's Healthy Homes program. I think Toby's going to we'll talk about that later on. So we do have a small number of those. At the moment, it was alluded to before that these are mainly pilot programs and proof of concept programs. So obviously, improving the regularity of those over time will certainly be advantageous. And then in general, of course, we have Victoria is a private regulated market, so we have market regulation and other forms of policy at a higher level that can help us. But certainly there is much more opportunity that we have to do even more.
Yeah, here, and we'll definitely come back to that. I loved your mention of advocacy and coalitions as well, because that's a large part of today, which we'll of course revisit later as well. Ginny, if we turn to the involvement of the health system and health professionals, what are the barriers that currently exist to getting health professionals involved in addressing energy poverty and supported to do so?
Yeah, so one thing to keep in mind is that what we're speaking about so far is what the literature review showed us. So we did a literature review, and we also did what we called system mapping. One of the things about literature is that it doesn't actually tell you all that much, which is very sad to say as an academic in particular. So the literature doesn't have a lot of examples of how the health sector has been involved in the response to energy hardship. There are some examples, and what they've tended to be around are where the health sector has helped to link people to some of those initiatives that Nick's described. So you'll have different programs that might be about financial relief and so on, and the health sector will become involved, and this is true internationally too. The health sector will become involved in a way of identifying people who are most likely to be at risk of health consequences because of their energy hardship. So a lot of that doesn't get into the literature, unfortunately. And when it does get into the literature, we don't get a lot about barriers, I have to say. So, but the sort of typical things are we get a sort of description at a higher level that there is a barrier in that it's not always recognised as a social determinant of health. So in health, as you know, there are a whole set of experiences people have and circumstances that they live in that make them much less likely to access healthcare, but also to experience poor health. And unfortunately, those characteristics and experiences are often similar to those that lead to energy hardship. There's a huge overlap. So what the health sector tends to get involved in is around saying, well, where are the people that are likely to be experiencing this? How do we see them? But if they're not actually if they're not alert to the idea that that's a social determinant, then they may not do something. So that's one barrier. Then the second is much more sort of local, I suppose, in the sense that people need to have time. And that's a real challenge. It's, it's often written as a barrier. People, when they write their journal articles and things that get into the literature, will say, oh, we had issues with certain people fulfilling role because they didn't have time or an opportunity. And it's, it's not just an excuse, it's genuine. Yeah. It is genuinely the case that we expect a lot of health professionals. And so not having time to do things is a serious issue that is a serious barrier to anything that we try in the past and anything we try in the future.
Yeah, wonderful. Thank you. And you mentioned the systems mapping work. I'm wondering, what are the possibilities for intersection and interaction that you identified in that particular piece of work?
Yeah, so this is when we did the system mapping, which was much more sort of looking like a sort of survey across the internet, really. You know, Nick was beavering away, sort of digging through the World Wide Web.
It's an official academic term.
That is
beavering away.
Beavering away and
Yep.
digging.
Excellent.
So we do a lot of that. He found more examples, for instance. So more examples of where we've seen the health sector working together. We found examples where they might be individual programs where a particular health service might take a role in helping to identify people and link them to services. And we also saw some examples of coalitions that were out there, coalitions of organisations. We particularly saw that when we were doing the system mapping, we could see where the parts of the system have come into play already, which kind of highlight for us the opportunities, as you say. So the community health sector, which is a particular Victorian jewel that we have, which other states do not have in the same way. So that sector, we saw examples where the primary health networks, who are the organisations who are funded by the Commonwealth government to help the general practice sector to be responsive and provide a really, well-rounded service. We saw the PHNs, primary health networks in there. We saw the more recently arrived local public health units, which are a new structure within Victoria and who have taken over some work of a previous sector we had, which was called primary care partnerships. And the primary care partnerships were very well linked across a whole range of health and community services to deal with things like social determinants of health. So we can see that there were examples there. We can see that they raise for us the idea of where the opportunity lies and where there could be more work and more collaboration, for example.
Yeah, wonderful. And a great shout out to community health. We'll be hearing from CoHealth later in the session to expand on that. But the jewel in the crown, I think, is an apt description. Just a reminder for everybody at home, if you do have questions throughout the course of today, put them in the Zoom Q&A, not in the chat. We won't be answering them right now in this little discussion, but later in the session today, we will be. So please have them coming through. Sort of a big question to finish, maybe the big question, but what needs to be done to ensure the success of Victorian initiatives, future Victorian initiatives?
Yeah, I think this is multi-layered, and Nick, you might like to speak about the big concepts that are there.
Yeah, absolutely. This sounds very, very simple, but it's also very important. We need to define energy hardship in a strategic sense. So, I mean, at the start, I mentioned several different terms, energy poverty, fuel poverty, and so forth. So there's a lot of different ways in which to communicate this very common phenomenon. And so I think one of the biggest things that will help move things forward is if we're speaking the same language. So having a formal definition that can be recognized across sectors is really important. So I think the first and foremost thing is to define energy hardship. Also having a robust set of indicators is very important. There are many different ways of measuring energy hardship, and no single measure is going to be perfect. It's going to give you different types of data. So there are many ways in which it's done. A common way is to look at someone's income spent on energy services and the percentage of that. In other countries, self-reporting is a way of looking at if people are facing energy hardship. Often combining these indicators is the best approach. But as I say, these different indicators will give you different results. I'll tell you different types of cohorts that are at risk. So the way in which we measure energy hardship and the indicators that we use are also really important. Those are the two high-level ones that I think are really important. I also think that precisely what we're doing today in terms of communicating it and building a coordinated approach that makes sure that we're not doing things in policy silos is also really important, because this is a cross-sectoral opportunity.
And I think that's key. And as you say, it's sort of why we're here today. And Caroline mentioned it too, that, there's a well understood, or it's a reasonably strong link between housing and energy now. People, your house is kind of where you, as an individual, where you're spending your money on your energy, and that's where you're trying to cook and live and be warm and be cool and so on. So, the housing link's there. But as Caroline said, recognising that there are health consequences when you lack that access to affordable energy is kind of, I don't think it's new in the sense that we know, and I know from my own work, that when I speak to health professionals within the community health sector, which is where I mostly work, individual health professionals will tell me all the time when they have seen someone and they've tried to respond to a need in someone. And what they need is something they can do that's relatively easy to do. So they need more support, more resources. I think we need to also make sure that it's well understood that energy hardship and access to energy is a social determinant of health, and but it's sort of enough. It's one thing to know that something affects someone's health poorly, and it's another to know what to do about it. And as we said, with time as a very genuine barrier to our expectations of what people can do, we have to think about, and we have to make sure there are resources, that there are places to refer people to, that when you do refer them, they are going to get a positive outcome. So it's very sad when I hear people say that they have approached certain funding bodies to get help for someone and they've been knocked back because they didn't fill form in right, or they didn't use the right words and so on. Yeah. And this is, a health professional trying to access the system on behalf of someone. And we're kind of saying, well, consumers, surely you can do it by yourself. Now they can't. And so we do need everybody to sort of work together and to help. And I think too, the other thing with the mapping too was, and a lot of people who will speak shortly that come from a sort of more experienced energy angle will recognise too that we also need people in the energy sector to accept that there is this health consequence and to think together about how to do it. So, it is complex. It's the sort of problem which, again, many of the social determinants are, where one government department can sort of flick it to another and say it's not really our problem. And so we kind of have to, we do have to form coalitions and strong understanding that it does require a multidisciplinary, multi-government, multi-organisation response. It needs cooperation, collaboration, all those things that, VCOSS is about, and that we're here for today.
Yeah, wonderful. We often talk at VCOSS about joining the dots. That's the metaphor we use for intersectionality, but also for coming together for collaboration. And I feel the way you've described it, we have all these different areas and we need to sort of meet in the middle, and go from there. Just one final one without notice, Nick, the notion of, the need for a clear definition or, some clear language. Is that the role of government? Is that the role of, other players, or actually doesn't it matter as long as we land somewhere that we can all,
I think it's a collaborative approach. I think that many different actors, if we combine as many different responses, of course, guided by other policy from across the world, that would be the best way to do this. It's this is a central academic discussion in itself. There's a lot of work that's been done in New Zealand, for example, about what are we trying to describe here? Do the current terms that we use really sort of hit the nail? So, there's certainly an academic opportunity in itself, but I think when it comes down to it, many different actors can help us build the best definition.
Fantastic. Jeannie, Nicholas, thank you very much for your time, your expertise. You'll be back later in the forum to take part in that panel discussion.